Regular chiropractic adjustments always play into the mix because the bones of the back can get jammed, and chiropractic is the only thing that can unjam those. The second thing you have to do to maintain back pain is do some regular form of exercise, both resistance training and aerobic type exercise. Aerobics about 30 minutes a week, 30 minutes a day, 3 times a week, and weightlifting 20 to 30 minutes a day, 3 times a week would probably do it. Followed by some sensible stretching, and you can stay in good shape. I wanted to go over one of the ways that we can work on someone with low back pain. If we look at the spine here, this would be looking at somebody from behind. I'm going to set the spine down here on the table. Sometimes folks have pain in the side of the lower back, not dead in the middle, but off to the side, and that is pain generated from the SI joint or sacroiliac joint. And so how we work on that, we have to restore the motion of that joint. And a great tool to use is the arthrostem. And what we do is we just palpate or feel to see which is moving and which is not, and we find the areas that are stuck, and we just want to restore that motion. As we restore the motion, the body then restores that nervous input from the joint up to the brain so that it moves normally and feels a lot better. So that's one of the ways we can work on SI joint pain or low back pain that's off on the side. There are certainly many helpful therapies that can come into play, provided you're getting your chiropractic care. Well, or even if you're not, massage therapy is very helpful. A really good supervised stretching program, such as one that you might find off of, let's say, a video. Some strengthening work, like physical therapy, can a lot of times do a lot of help. Because you want to have a strong body. You want to be able to strengthen that injury up after it's been weakened from the impact. So. Medical doctors as patients throughout the years, and one thing they always tell me is that, well, Dr. Owens, when I show them their x-rays, they say, well, some of them, they say, treat me like a regular patient because we did not, we don't look at x-rays every day. We have radiologists to look at those. But the medical doctors are going to be looking for, or even medical radiologists are going to be looking for big things, big diseases, tumors, bony infections, or severe arthritic processes, fractures, let's say. That's really what they're looking for. If they don't see any of that, they call it normal. And that's normal to them. However, what we're looking for as chiropractors are abnormal configurations. We're looking for early stages of arthritis where we see bone spurs starting to develop. So before they've developed into an extreme level, we're looking for misalignments of the spine, abnormal curvatures. Medical doctors don't really catch those because that's not what they treat.
Dr. Owens, I was wondering, what is a vertebra and what's its purpose?
All right. Well, a vertebra is simply one of the bones of the back. There are 24 of them. It's surrounded on either side by a vertebra and a vertebra, unless you're talking about the top vertebra, which has the skull above it. What is its purpose? Well, its purpose is to provide a stable structure, yet movable structure, so that we can move from a central axis. Its other purpose is to protect this spinal cord that houses the nerve tissue that comes from the brain. There's a spinal cord there, and it goes down. As it goes down the spinal cord, the nerves come out in between each, underneath each vertebra. The nerve comes out, and those nerves go to every cell and tissue in the body through its very thorough branching style network. And in the spine, if you have a pinched nerve or a vertebra that's moved out of beyond its normal range of motion affecting this nerve, wherever that nerve goes, you can get a problem. So in chiropractic, that's what we do, is we correct those spinal problems, those vertebra problems. Proper function in life can sometimes take a while. That's a matter of getting the ligaments and muscles strengthened up around the injury site. For example, let's say a low back pain, that can sometimes take a little while to restore full function. However, pain relief sometimes occurs after the very first visit. Typically, a patient will have some relief after their first visit, and a large amount of relief after 5 to 7 visits.
Okay, that makes sense. Why does one get back pain during pregnancy? What causes it?
Back pain during pregnancy is caused by excessive forward shift of the pelvis as the weight transfers from the front, and this is a weight that the lady's typically not used to having. It alters everything and jams nerves in the lower back, causing pain and spasm.
What happens to the spine, the nerves and stuff, if a person goes untreated for too long of a duration? Like there's a subluxation or something just gone on too long.
Anytime a health problem is let go on too long, it's it continues to decay and get worse. With the spine, what can happen is that you will develop the arthritis, and that involves the disc. You're losing the disc height or having a disc problem, a bone problem with bone spurs, which really restricts motion and catches and severely restricts the way you can move your spine, your neck, and severe compressed nerves. With this compressed nerve, wherever this nerve goes, you're going to have a diseased area of the body. If it's this nerve that goes to the lungs, this person is undoubtedly going to have a lung problem of some sort. Or similarly, into the lower intestine, they're going to have a lower intestinal problem. So, to get back to your original question, don't let these things go on too long, because as they go on too long, they form permanent, sometimes unhelpable problems that me, a chiropractor, or even a surgeon can't even help. Pain medication that you take over the counter is what's called a non-steroidal anti-inflammatory drug. Those are safe if you've used them very short periods of time, if the pain is very severe. I always say stay away from them if you can, because these inhibit inflammation. Inflammation is the first step of the healing cascade. So in other words, that starts the healing process. You don't want to stop that right at the beginning. You want your body to heal itself. That's what it's designed to do. Second thing pain medication can do is give you a false sense of security. In other words, you feel like you're doing better and you go out and re-injure yourself that much easier. So I recommend against pain medication in a lot of cases for the very reason that of those things. Now, as a chiropractor, I can't recommend a patient take drugs or not take drugs. It's not in the scope of my practice. For further consultation, of course, see your medical doctor.
Dr. Owens, I know that, I know a lot of people have had whiplash or, hyperflexion, hyperextension or whatever, and, never got it treated or anything. They got rear-ended at 20, 25 miles per hour, and it hurt a little bit. It went on for a while, and they never got treated. What would be the ramifications of not treating those conditions?
Well, the one that people notice first is pain. Insurance statistics say that up to a year after any form of accidents, 90% of the people have pain. So tells me that injuries are occurring 90% of the time. If still untreated, well, and at that time, a lot of people don't make the connection. They say, all of a sudden this mysterious pain starts in the neck, and they never connect it to the car accident. So obviously chronic pain can occur. These areas where you see here the tears and ligaments, these develop scar tissue. The body does its best to try and patch that up. It puts what's called scar tissue in there. And the characteristics of scar tissue are that it's weaker than normal tissue. It's less elastic or less stretchy, and it has more pain nerve fibers. So it's more painful. So if you get a lot of areas of scar tissue, scar tissue and fibrosis starts to expand. Now you get normal motions that cause pain on a daily basis. So with proper care, that can be avoided. Without proper care, you get restricted range of motion, scar tissue, fibrosis, and pain. Not a great thing to have going on.
Dr. Owens, what are the dangers of auto accidents?
auto accidents, provided you didn't get hospitalized or nothing broken or fractures and death can result from auto accidents, but provided none of that happened, the biggest dangers of an auto accident comes about from the mechanics of the injury itself creating a situation where there's chronic pain, specifically in the neck. If we look at the mechanics or the head, you're in your car seat, hopefully your car seat's all the way up, but typically the head will translate backwards when another car hits you, and when it goes backwards, all the structures in the front of your neck will tear. You can get some tearing in the front muscles like the sternocleidomastoid muscle. You can get some tearing in the little ligament that runs down the front of the spine, creating some weakness. Then the head then goes back forward with the potential of tearing muscles and ligaments in the back. Now, when these structures tear, specifically in the back, is what gives us the chronic pain over time. Research tells us there's little receptors in here called proprioceptors, and they're parts of nerves that get injured. When these get injured, the head doesn't know where it's at in space, and you get the potential for re-injury and chronic pain. So that's one of the biggest things to fix. As we work with you with chiropractic care, getting the bones back in the corrected positions, working with the scar tissue of the muscles and ligaments, we restore it as much as we can to its prior state, and help prevent that chronic pain from happening for the rest of your life.